Can an educational intervention improve healthcare provider confidence in diagnosing adult ADHD? Overview of adult ADHD history. 8.7 million adults are estimated to have ADHD in the United States. 6.8% of adults worldwide experience ADHD symptoms. 62% of adults in healthcare settings meet the criteria for adult ADHD but continue to remain untreated. Approximately 1 in 25 adults in the U.S. have ADHD. History of adult ADHD. ADHD is a complex problem missed in childhood diagnosis, which creates persistent challenges for adults with ADHD. Untreated adult ADHD leads to multiple problems in life functioning domains. The American Psychiatric Association Diagnostic Manual of Mental Health Disorders, 5th edition, categorizes ADHD using 3 criteria: predominantly inattentive type, predominantly hyperactive ADHD, and combined type ADHD. 90% of adults with ADHD go untreated. Untreated adults with ADHD have poorer health outcomes. Epidemiology of ADHD. Major pathways related to the pathogenesis of attention deficit disorder include the dopaminergic and serotonergic pathways. These neurons are primarily located respectively in the midbrain and hindbrain and control various functions. Abnormalities in dopamine and serotonin levels contribute to symptoms of inattention, hyperactivity, and impulsivity. ADHD has significant genetic components. First and second degree family members are at a higher risk for the disorder. Health disparities regarding race. The estimates of adults who were diagnosed with ADHD and who are currently shown to have ADHD include the following. Hispanic origin race is divided into Hispanic and non-Hispanic. Hispanic is further divided into Black or African American or non-Hispanic, white only or non-Hispanic. And we can see that the rates for white and non-Hispanic with ADHD in November through November of 2023 were the highest. This is from the National Center for Health Statistics. Percentages of adults who currently have ADHD in the United States. Also from October to November of 2023, we notice that the highest age currently presenting with ADHD is 18 to 44, and providers should also be aware of this when they are assessing and diagnosing patients within clinical settings. This is a visual showing us the 3 major types of diagnoses for ADHD: inattention, hyperactivity, noting that the combined presentation kind of overlaps both of these, hyperactivity and inattention. So providers should be taking this into consideration when diagnosing adult ADHD in clinical settings. Here are the barriers to adult ADHD diagnosis. Limited recognition and comfort level among healthcare providers. Healthcare providers' need for education to address misconceptions, and then time constraints and stigmas from healthcare providers and persons diagnosing, professionals diagnosing ADHD in healthcare settings. Healthcare providers may have been trained to diagnose children, but they often lack competence in diagnosing adult ADHD. Barriers also may include lack of recognition in clinical settings in diagnosing adult ADHD due to lack of experience with these types of adults. Due to this, in clinical settings, adults with ADHD are often diagnosed with other disorders such as anxiety and depression. Here is an algorithm that is helpful when diagnosing adults with ADHD in clinical settings for healthcare providers. It includes a patient psychiatric and medical history, reviews any current and past medications. The healthcare provider should also ask if any family members were diagnosed with ADHD, including children of the patient, or if there is an ADHD history in childhood. The healthcare provider should ask about early school history, issues with math, listening, organization, and the ability to complete assignments. This should also include probing questions about whether or not the student was a perfectionist or they spent hours trying to finish tasks that would normally be quicker. Questions should include, did you finish high school, college behaviors, academic records, including job histories. Did the person change jobs a lot? Were there interruptions in work habits? Does the person interrupt others? Do people often complain that this person may forget to follow through with text or phone calls in relationships? And do they feel that they often struggle to listen to others? Clinical presentation for adult ADHD diagnosis. Diagnosis should be made after a review of assessments and ruling out other diagnosis. This may take several meetings with the patient to assess. The use of the DSM classification criteria to confirm adults over 17 years of age should include 5 symptoms needed to be present for the diagnosis. Note persistent patterns of inattention or hyperactivity present before age 12. Note that symptoms do not include the presence of schizophrenia and could not be explained better by other disorders. So healthcare providers should be noting that there are 5 symptoms present. Instead, with children, there must be 6 symptoms to be present for a diagnosis according to the DSM. So healthcare providers need to be aware that there are 5, and they should rule out any other behaviors such as bipolar, schizophrenia, anxiety, or personality disorders. And the key is to look for contextual clues when assessing these patients. Tips when diagnosing adult ADHD. Healthcare providers should use a semi-structured interview. They should use a detailed history, including age of onset. They should note a family mental health history and review common occurring problems such as emotional outbursts, tempers, and sleep problems. They should also note any functional problems, including job loss, dropping out of school, relationship or money issues, and problems with daily responsibility. They should rule out any comorbid conditions during the initial assessment. This would include using a depression scale such as the PHQ-9, an anxiety scale, GAD, mood disorder assessment, and rule out PTSD using the PTSD checklist. These are some ADHD diagnostic codes that healthcare providers should be including in their initial findings for ADHD. Here is a list of symptoms for adult inattention. This would include struggling with attention to detail, often making mistakes, difficulty with sustaining tasks or activities, unfinished projects, leaving school to the last minute, not completing or staying at work to finish or not finishing tasks without imposed consequences, like they're going to lose their job, they might fail the class, difficulty organizing tasks, losing items for the task, chronically late for activities. Other questions might include, does the person have problems getting out of bed? Often people with inattention ADHD or types of ADHD will have several alarm clocks that they set to go off, and they're sleeping through their alarms or sleeping too late. This is a common problem. Symptoms of hyperactivity, impulsivity. You may notice that the patient who is sitting in the room is fidgeting. They may be looking at their phone a lot. Their speech patterns may be tangential. They may be having to be redirected several times in the conversation. They often report that they fidget with their hands. They feel restlessness in movements. They are unable to engage in leisure activities. This would include a person saying they can't watch television. They often feel as if they are driven by a motor. They might be cleaning a lot excessively, and they might call themselves having like OCD symptoms, but it's actually ADHD. They're interrupting others. They seem to be talking in a stream. It may be difficult for the healthcare provider to interject. They have difficulty waiting for their turn and urges to leave. Adults with ADHD also may present with masking symptoms. Healthcare providers should be aware of how these patients may try to minimize their symptoms, fail to living up to potential, repeating courses, overwhelmed at school, taking too long to complete assignments, relationship issues. Spouses often report they don't feel listened to, anger outbursts, difficulty juggling work and other responsibility. The patient may report feeling overwhelmed, anxiety in the context of trying to get schoolwork done or trying to stay caught up with things at the job. ADHD adult assessment diagnostic techniques. Assess if the patient was previously diagnosed in childhood. Complete a mental health assessment. Use assessment scales such as ASRS, Connor's short version. Assess functional impairments. Assess co-occurring disorders. Assess medical disorders. Here are some assessment tools that the healthcare provider should be familiar with. A common version is the ADHD self-report screening scale. Now they do have short versions of these and long versions. And the Connor's adult ADHD rating scale is another one. The Wender Utah rating scale as well may offer some insight as to helping the patient describe their childhood in better detail in some of the emotional dysregulation of ADHD and other problems related to ADHD that might provide a better picture for healthcare providers when making a diagnosis. Here are resources for adult ADHD that healthcare providers, once a patient has been given a diagnosis, can share with patients to help them understand the disorder and provide them resources that will help them link to other groups and organizations and information regarding ADHD. Thank you.